4 reasons why your doctor will not pull a full and complete thyroid panel, and I guarantee number 4 will completely surprise you. I'm Dr. Scott, and before I start, let me just say this. There's a lot that happens behind the scenes in medicine and in healthcare that you don't see. There's rules, there's regulations, there's liabilities, there's group contracts and insurance contracts. So with that said, many times it's not that your doctor doesn't necessarily want to pull these or not willing to pull it. It's because there can be some serious consequences if they do sometimes. So let's talk about it. Number 1, their treatment doesn't change. Why pull additional tests if it's not going to change how you're going to treat the patient? The standard of care in the United States is hormone replacement therapy. That's it. The only markers you need to determine that is TSH and T4. So why pull anything else if it's not going to change what you're treating? Now, it drastically changes what we do. In fact, I can't even tell you what's wrong with your thyroid without a full thyroid panel. Number 2 is insurance won't cover it. You're like, well, why won't it cover it? Well, it brings us to number 1. The treatment doesn't change. So why should they pay? Because it's an expensive panel. So why should they pay for it if it's not going to change the outcome or the treatment outcome? Number 3 is when you're a doctor, you're responsible for that lab that you're pulling for the patient. And if you're pulling labs you just don't know what to do with, then there is a bit of a liability for that physician or practitioner. So that's another reason why they won't pull it. Finally, let's talk about number 4. You see, when your doctor becomes a provider with your particular insurance carrier like Blue Cross, Aetna, whatever, they sign a contract, a provider contract that they are agreeing to stay within the norms of the providers from the insurance. And the insurance dictates what those norms are, not the doctors. So since the norm for thyroid is TSH-T4, you go outside the norm, well, that insurance company can kick you off as a provider. And if you get kicked off of a provider as Blue Cross, for example, well, then you very well will probably, that physician will lose their job because they're not able to provide services for a major carrier. So this can be very big deal, and this is why they won't go out of those norms. They're not willing to do it. This is why we don't run it through the insurance, at least with the thyroid panel, is because they're not going to cover it, and we're not being dictated from them. And we get 80% off of labs. So if you're sitting there sick and tired, you want to get additional labs, you want someone to take a fresh look at what's happening so you have some real solutions, schedule a case review. We'll go through everything and tell you what